Measles is making a troubling comeback, and the latest surge in South Carolina is a stark reminder that this highly contagious virus isn't something we can take lightly. After all, it can strike down our communities in the blink of an eye. But here's where it gets controversial. As cases climb, debates about vaccination and public health measures are heating up, leaving many wondering if we've forgotten the lessons from past outbreaks. Dive in to uncover the facts, the precautions, and the spark for discussion that might just change your perspective on this global health challenge. In the heart of upstate South Carolina, specifically Spartanburg County, health authorities have confirmed 3 additional measles cases just since Tuesday. This brings the statewide tally for the year to a concerning 19, with 15 of those linked directly to the ongoing outbreak. To put this in perspective for newcomers to the topic, measles is a viral infection that spreads easily through the air via coughs and sneezes, often causing fever, rash, and severe complications like pneumonia. It's far from just a childhood nuisance. The good news here is that these new cases stem from close contacts of previously identified patients who were already isolating at home. Crucially, none of these individuals were in school while they could transmit the disease, and since they quarantined before becoming infectious, officials report 0 additional exposures. This proactive isolation strategy highlights how timely action can halt the chain of transmission, a simple yet effective way to protect vulnerable populations, like unvaccinated kids. Stepping up their defenses, Prisma Health, a major hospital system in the region, has rolled out stricter masking rules across all their emergency departments. This move is all about putting safety first during this outbreak, safeguarding not just patients, but also visitors and hard-working staff. Let's break it down, step by step, to make it crystal clear. First, upon entry, everyone heading into the emergency department must don a mask right away. Think of it as a universal shield until a nurse or doctor assesses you at triage, ensuring no one slips through without basic protection. Next, the hospital is taking a safety-first approach overall, crafting these protocols to minimize the risk of spreading the virus and creating a secure space for all. For instance, imagine a bustling ER on a busy night. These rules help maintain that controlled environment amid the chaos. Then there's symptom-based masking. If you show up with telltale signs like a fever, skin rash, or breathing issues, you'll be asked to keep your mask on during your entire visit inside any Prisma Health facility. This is key because measles symptoms can mimic other illnesses, so erring on the side of caution prevents unintended spread. Finally, parental precautions are in play too. Unvaccinated parents tagging along with kids exhibiting fever or rash might also need to mask up. It's a thoughtful extension of the policy, recognizing that caregivers are often the frontline defenders in a child's health journey. But this is the part most people miss, the power of vaccination in all this. Dr. Cathryn Burch, a seasoned pediatric infectious disease expert, points out that receiving both doses of the measles, mumps, rubella, MMR vaccine grants lifelong protection against this pesky virus. For those just getting vaccinated, she explains that it typically requires about 2 weeks for the body to build up those crucial antibodies, acting like a personal immune army ready to fight off infection. And if that weren't enough to underscore the urgency, Burch calls measles the easiest virus on Earth to spread, which is saying something in our interconnected world. To illustrate, consider this chilling fact from Dr. Burch. The droplets within the virus that somebody might cough up when they're sick with the virus can stay in the air for up to 2 hours, even after the person who is infected with the measles has left the room. Picture lingering droplets like invisible booby traps in a room, posing a risk long after the infected individual departs. It's a vivid reminder of why masks and ventilation matter so much in public spaces. Yet, amid these facts, controversy brews. Some skeptics argue that vaccine mandates infringe on personal freedoms, sparking heated debates about individual choice versus community protection. Is it fair to require masks and shots for everyone? Or does this overstep in a society valuing autonomy? Others counter that collective immunity is the ultimate safeguard, preventing outbreaks from overwhelming our healthcare systems. What do you think? Should public health always trump personal beliefs? Or is there room for nuance in how we balance safety and liberty? Share your thoughts in the comments below. I'd love to hear your take on this polarizing issue.